Hello everyone and welcome back to my channel. I know it's been a very long time since my last video and a lot's happened since then, and I wasn't planning to make this video for a couple of months later, but I've had so many students messaging me on different platforms asking for advice, and a lot of students that are nervous about work in the UK, so I decided to make this video a little bit earlier and share as much information as I can. Now, I'm not going to go into a ton of detail on certain aspects of the questions. There is actually a lot more that I could say, but I did try recording it before and it took a very long time. So I plan to do a separate video on a couple of things that may be needing more time. So I'm going to give you an overall Q&A and update you. I'm first going to update you on everything that's happened so far, and then I will do I will do a Q&A on the different questions that I've had from all of you guys. So the first thing is to update you on my life. So I've started work. I graduated from university in Bulgaria. I actually completed my exams in September 2019, finished all my exams, and then I started work in December 2019. So it's been 3 months since I started my first job as a junior doctor. So let's begin with the questions. If you're wondering where I work, I don't work too far from home. I work within an hour away from where I live. I don't really want to give the location because, it's the internet. It's not exactly the safest to tell you where I work, but I work at a place which I'm significantly happier with after, being in Bulgaria for 6 years and flying back and forth. But I always told myself I'd be happy wherever I worked as long as it was within the UK. So to be able to not be too far off is a blessing in itself, but I think that anyone who's able to get a job within the UK after being abroad for that long, that's an amazing accomplishment in itself. And I'm sure I will see many of my students and colleagues in the lower years and from other universities excel and become very successful in their future medical careers. I'm just going to share some information now about, information from preparing yourself for work to what is expected of you at work, and go along with the questions like that. So I have my laptop in front of me, got the questions in front of me, and I'm just going to talk about them. This isn't going to be a very heavily edited video simply because I don't have the software for it and I'm just terrible at editing in general, and because of work I've just been very busy and it's quite difficult for me to spend a huge amount of time on these things. I'm not using it as an excuse, I'm just being honest, but I will share as much as I can and I hope it benefits you. So first things first, preparation for the documents. So this is something which is only really applicable to people who are in the older years, and then I will go into information which may be more relevant to the lower years on how to get through your degree in terms of preparing yourself for work in the UK. So the first things first is about your preparation in terms of the documents you need to register on the General Medical Council in the UK. The first thing is you will need your actual degree. So you can either have your full degree or you can have a provisional certificate that states that you have completed all of your exams, and the last date you completed your final exam with your your name and your identification number. The GMC has a full sort of criteria of what exact details you need on this document. It's pretty simple. It's only one piece of paper and that is sufficient enough for you to register on the GMC. All you need to do is request that from your university once you've finished your final exams, and that will be your temporary degree until you get your full degree, because for example for Plovdiv it was in December we got our final degrees. I started work in December, so there was no way I would be able to get my degree that quickly and get everything sorted and then start work in the same month. So I did so in September when I finished my exams I had a provisional certificate which I used, and I translated that into English. So you can translate that within the UK or translate that within the country you're working in, where you studied in, as long as it's an official translation service. So I used a company in Bulgaria with an official stamp which was all official and it didn't cost me much. Translated that and I used that to register. The other thing you will need is your evidence of English language. Even though we all have British passports, unfortunately you still need to do an English speaking exam because your degree was technically from a foreign country which doesn't speak English. So You can either do two options. This is the IELTS exam. So you can, sorry, I don't even know what happened there. You can either do two options, the IELTS exam, or you can do the OET, which is the Occupational English Language Test, I believe. Now, IELTS is more readily available all over the world, and there are more dates, and it's cheaper. But OET is the easier exam as far as I know, but it's the more expensive exam. So I actually had to do IELTS more than once, and I struggled with the essay writing part. And even though I read a lot of books anyway, so I always thought that, you know, it would be easier for me, but unfortunately that wasn't the case, and I did struggle. So my advice is for you to go down the track of the OET. Now, it's really up to you. Some people pass IELTS the first time, so it's not, I wouldn't say it's something which is set in stone. It's just my general advice to go for the OET exam. So that's the first thing, is for you to have your degree or provisional certificate that says you've passed all your exams, and that can be your temporary degree, along with an evidence of your English speaking. And you can use those two documents to register on the GMC. And what you do is you scan these documents into the computer, you send them off to the GMC, as well as making an online account. It's on their website anyway, all the details you need in order to make an online GMC account. You send those documents off, and then you'll be called back for an appointment, which will be either in Manchester or in London. So my plan was that I was going to work in December, so I had to make sure I got all the documents sorted before then. And at the time, the only last appointment available was only in Manchester, and it was literally the last slot. So I was fortunate enough to get that booked, and I went to Manchester. I was extremely nervous that day, thinking it was going to be a very stressful appointment, you know, having to show my documents, having to be very professional, and I don't know what I was expecting, but it was the most easy appointment. I was so comfortable. The staff were very nice, and it took around 10 minutes. And then in front of you, you were registered on the General Medical Council on the website with a GMC number. It was that part was probably the most simplest part of everything for your process of registering. So, about work, I actually was fortunate enough to get a job through NHS professionals. They were the people that helped me get a job, because they allowed me to work as an FY1 rather than going straight into FY2, which is what people who study abroad generally go into, because we have full registration. But from the experience I've had at uni, and from the experience I've had working in a hospital as an FY1, I do not recommend to go straight into FY2. There is so much learning that we have missed out on, and there is so much we need to adapt to in terms of work in the UK. And the pressure of an FY2 is double that of an FY1. When you're an FY1, you are, the baby of the hospital. There is not that much that is expected of you, in the sense that you can afford to ask more and more questions. You can't afford to make a couple of little mistakes. People understand that you're an FY1, that you're new to all of it. When you're FY2, people have a different expectation of you. So it's not easy to get an FY1 post, especially a training post. NHS professionals helped me get a training post in a hospital, which I was fortunate of. But at the same time, if for example you don't end up going through NHS professionals, or you want to do a non-training post, then I recommend that you do a clinical attachment for a few months, get yourself adjusted to work in the UK, what is expected of a doctor in the UK, and then go straight into FY2. And if you can, potentially go into an FY2 standalone training post. The benefits of a training post versus a non-training post is that you have supervisors who will, guard you, educational, clinical. You'll be able to attend teachings. You'll be able to have access to, online platforms for training, and you can make your own portfolio, which you can ensure that you get signed off for different competencies. And your competencies are what you need in order for you to go into the next stage of your specialty training. Now, there is a lot that I can go into in terms of what you need as in your training post, in terms of competencies, in terms of, clinical-based discussions and teachings and so many different things. But I will save that for a different video. I'm just giving you a rough idea of what is expected in a training post. And a training post, you will be expected to do a lot outside of your actual job. And I guess because you're in the training post, you are constantly reminded and you're constantly kind of put under that pressure to do those things. If you're a non, if and you will obviously learn a lot more because you're having those services offered to you. Now you can do the same in a non-training post, but you have to remember it's all done quite independently, and you have to kind of make do with all those things yourself. So it may be easier to go into a training post. That is the first thing. So if you're wondering what I'm doing, I'm in a training post at the hospital that I work in as an FY1, and I have an online portfolio platform, which is Horus Portfolio, which I use in order for me to sign off my competencies, in order for me to sign off my clinical based discussions and my teaching hours and any other evidence I can put on there to show that I'm doing what's needed of me in order for me to go to the next stage of my job, which will be FY2 and then specialty training. So everything is about, in your foundation years, everything is about getting to specialty training afterwards. And if you can do what is expected of you within work and outside of your work and prove that you are going up in the ladder in terms of your learning, then it's going to make you much more make you much more appealing for your specialty training. So that's that. That is me talking about what you need in terms of preparation for work in the UK, in terms of documents and non-training versus the training post. Now I'm going to talk about what you should be expected to learn while you're in medical school or prior to working in the UK if you're planning to work soon but you haven't started work yet. So the first thing I would recommend is that you learn a few things. One thing is your history taking and your physical examinations. I have emphasized this in previous videos, but you will be required to know these, especially when you go into emergency or acute medicine as part of your on-call posts. Like, for example, I work in acute medicine for my on-call posts, and in those posts, I do a lot of clerking. And for the clerking, although in the booklets you have everything inside which says you need to, for example, do a respiratory examination, you need to do a cardiovascular examination, etc., they don't go into that much detail. And when a new patient comes in, you're expected to get all the details out and find anything abnormal. On top of that, you are expected to do a thorough history taking, and the history taking is something you will have to do in as much detail as you can yourself. So I recommend that you practice history taking skills and physical examination skills thoroughly. You practice it with your friends, you practice it at home, with your family, you practice it in simulations, but you need to get your basis, which is your physical examinations and your history taking. Once you've done that, then you can go on to the next things, which are, to be honest, you can do at the same time. So the first thing is you will need to learn some ECGs. So ECGs, I wouldn't say you need to know to a great detail as of yet in the beginning, but ECGs are very useful to know because as a doctor, you are expected to know ECGs, and a lot of the time you may have nurses that will come up to you and give you an ECG when you're on your ward cover or on-call post, and they will ask you, can you interpret this ECG and sign it? So once you sign that document, it basically says you've said that if it's normal or abnormal, and if you've signed it and you're saying that it's normal, it goes on you if something abnormal is on that, but you signed it off that it's a normal thing and it can come back to you. But luckily you are able to get a senior. You can escalate it to a senior if you're unsure, and you can say, actually, I'm not prepared for this, I'm not sure if it's abnormal. I would go to the FY2 or the SHO and ask them instead. So you have that option available to you in terms of signing things off in terms of ECGs. But I do recommend you know your ECGs, because when you go on to your medical takes, which are your the work you do in the acute medicine units or A&E, you will have ECGs come back to you, and it's just useful not to have to always tell other people about it. And ECG is something which we are, you learn through our medical school. And I'm not saying you need to learn it inside out and be able to interpret them to a great extent, but it's good to be able to work out whether something looks normal or abnormal. So, working out the rate, the rhythm, if it's, for example, ST depression, ST elevation, or if you're having, a narrow QRS complex or a wide QRS complex, etc. It's just good to be able to, or a bundle branch block or an AV block. It's good to be able to pick out some pathologies and be able to pick out what is normal. And as I said, it's not something we should be perfect at. It's just good to be able to recognize if something is abnormal. and what maybe isn't. And even that, I'm not telling you to know it perfectly. I'm just saying it's good to learn it while you're in university. The next thing is arterial blood gases. Now, I work in the respiratory department, so ABGs are like second language on that ward now. Like, you need to be able to interpret an ABG. So, you know, if you can while you're in university, try to understand when a patient has type 1 or type 2 respiratory failure. Try to understand if they're retaining carbon dioxide or if they're not retaining it, and you know, just be able to find out whether a blood gas result is normal or abnormal. I mean, it's something which is very useful, and it's not just in respiratory, it's in every ward you will come across it. So if you can, learn your ABGs. The second thing, I've gone over ABGs, ECGs, history-taking physical examinations. Another thing you need to do is be able to learn an ATE assessment. Now, ATE assessments are not necessarily as useful when you're on the ward, because on the wards you are normally in a ward round, you're following your consultant or your group, and after that you will tend to do jobs from the ward round in the afternoon. But when you go on to your on-calls, so when you are, for example, on ward cover, or when you are doing your own independent work in, you know, medical take in the emergency departments, you will be expected to do your ATE assessment. So this is, you know, your airways, checking their patent, doing a whole respiratory examination for breathing, doing your cardiovascular examination for circulation, doing your D for disability examination, which is your Glasgow Coma scale and your blood glucose and your pupillary reflexes, going on to your E for exposure, so, you know, checking the abdomen, checking the legs, checking for any signs of bleeding or bruising or anything else. So doing a full thorough ATE assessment is very important, especially because when you go onto your ward cover, so I'll just explain. Ward cover is when you're covering different departments on your on-call shifts. When you're on ward cover, a lot of the time you will get your bleep, and a nurse will bleep you all the time saying that this patient is scoring a news of 5, of 6. That is the general policy. I believe in my hospital it's when they get a news of 5. So that means that something is going abnormal in their vital signs, whether it's their blood pressure's just dropped all of a sudden, or whether they've got a tachycardia or something else, and you will be expected to go onto the ward, go in to see that patient and do an AT assessment and figure out whether there is something abnormal and whether you need to, you know, treat it or maybe escalate it to a senior, or whether it's something which you might just need to ask the nurse to keep monitoring on a more regular basis and then call you back. But you will be expected to be able to do an AT assessment and document that. So that's the thing, that's also very important. And speaking of news, yes, so news is your national early warning scale. Every hospital has it, so it's just your basic observations of a patient. For every patient, they are always monitored on their respiratory rate, their heart rate, their oxygen saturations, their blood pressure, their temperature, and their disability. So if they're alert, if they're if they're unresponsive. So those scales are so there's a scale for that, and when the lower the number is, the more normal the patient is, the more normal their vitals are. If their news rises to a significant extent, or if it goes higher, you start to worry, and in that case, that's when you may be called in order to, you know, figure out what's going on with that patient. Why is their news like that? It may be normal for some people. It's more of, once it starts changing, that's when you start to become concerned, if it starts rising. So it's good for you to become familiar with the news score and your ATE assessments, and, you know, if you can, try to study that prior to going to work. The next thing is documentation. I have to emphasize as well. Documentation is very important. As a doctor, if you don't write it, it didn't happen. As any healthcare professional, if you didn't write it, it didn't happen. So no matter what you do in the hospital, whether it's just doing an AT, whether it's not just doing, but if you're doing an AT assessment, whether it's just discussing something with a family member of the patient, to maybe having a small discussion with the patient about a previous history of something which you want to go into more detail about, whether it's that you tried to do a job or chase up a job and you couldn't contact the person you were trying to chase up, it's always good to document that. For example, you were told to contact microbiology about a certain antibiotic for this patient because you were unsure whether they were suitable for it, but you were bleeping them, but they were not answering. You document that. That is your protection. That is your record, saying that you did try, but it didn't happen, but you couldn't get through. So you need to make sure that you document everything that you do. Another thing is you need to get used to is your signature. As a doctor, your signature is a very important thing. You will be expected to prescribe medicines, sign ECGs, and just everything you do, you will be expected to sign it. So you need to make sure that whatever you sign, you make sure that you know what you are signing. For example, if a nurse comes up to you and says that this patient needs fluids, it's your job, although you're the one that's only you can give those fluids because you are the doctor in that case. Don't just sign it because a nurse says. A lot of the time the nurses do know their patients even more than you, so you can sign it, but it's always good to ask them first, why does this patient need fluids? Or maybe go check their blood results. Is it suitable for you to give them sodium chloride? Is there anything abnormal in their electrolytes which is making you not maybe give them Hartmann's or something? So it's good to make sure that whatever you sign, or even a prescription, they ask you, this patient wants to have ibuprofen, and you need to sign it off. Okay, yes, you can sign a prescription, but what if they have, you know, a history of a gastritis or reflux or something, and you're not sure if you want to give them ibuprofen, but you sign it anyway. So whatever you do, although your signature is so important, you need to make sure that you take into account what you sign is your responsibility from then on. So take that as a very careful approach. Don't just sign anything for no reason because you can, because your signature is powerful at the end of the day. As a doctor, your signature is the one that will do the prescribing for the drugs, for the fluids, for ECGs, and for whatever else, which will, for, you know, anything else which will, which will obviously have an impact on that patient and the hospital in general. So that's that. So just to be aware of that as well. The next thing is, it's good to understand that once you do start work, you will have a lot of online platforms which will have blood results, which will have so one thing is going to your hospital induction. It's always compulsory, and before you start work, you will be expected to go to one. You are expected to do online training for the hospital, because hospitals in the UK have so many different systems for bloods, for scans, for different x-rays and CTs and whatever else, for a platform for their previous histories and notes from other hospital admissions. There is a lot to get through, and it took me a week or two to just adjust to all these different platforms because there were so many. But it's good to make sure you become familiar with those straight away when you start work. And another thing is electronic discharges. You will be doing EDSs or electronic discharges so much. When a patient is discharged, it will be your responsibility to write down everything about their hospital admission, to what they've been treated with on that EDS, so that can be sent off to the GP. Now, that is a very important part of it, because that is what the GP will get in order for them to continue that treatment and the follow-up, and it's an online, record. Now, it doesn't have to be too detailed, but it's just one of those things, again, as part of work in the UK, you will have to get used to. A lot of the work is done on the computers, as well as a lot of the work being done in your patient files, where you will have to document everything. I do apologise, by the way, if my talking is a little bit all over the place. It's already gone to 23 minutes, and I'm just trying to cover as much as I can, and it may be a little bit, what's the word? It's not following a very logical order, and I do apologise for that now. The next part is, when you do start work, just make sure that a few things that you should try to do is, as I said, get an online portfolio platform for everything. Make sure that you have your badge allows you to access the doctor's mess. It's good to have access to the doctor's mess, which is the doctor's staff room. You can use that when you are on long calls and, ward covers, and you're on calls, and you can go there to rest in your breaks. Make sure that you have access to a hematology pass, which allows you to carry out blood transfusions and do cross-matching and group and saves. Make sure that you have your logins for all your different systems in the hospital, whether it's accessing patient blood results and confidential files. And yes, and going on to that, confidentiality is extremely important. Do not share any patient details, patient numbers, patient names, anything like that online or outside of the hospital. That is something which you need to keep very personal within the hospital, within, the staff members that are looking after that patient, and within the trust. And always be careful not to share any other information out. If a patient, for example, is not feeling well as well, and there are people that are concerned about that patient, you need to figure out, are these people actually family members of that patient? Can you just give out details about that patient? For example, a patient is, diagnosed with something, like a cancer. Are you able just to share that information to a family member? Is it something the patient wants to share with the family member? You need to make sure that you don't throw out information without taking into consideration, is it actually breaching confidentiality? And that's when the GMC Good Medical Practice Handbook comes into line, and as well as a bunch of other guidelines which the GMC recommends to read prior to starting work. So do make sure that you read up on all those guidelines. Now, another thing is advanced life support. That is the next stage which you will be expected to do during your foundation training, and that is above intermediate life support. That lasts for 4 years and it's quite expensive. So you will be expected to do that within your first year of work. Do make sure you book yourself onto a course. It gets quite quickly booked around the UK. If you are in a training post, normally your trust will provide you with a date and they will enroll you on the course. Do make sure you do that course and you study for it 1 month in advance with the manual, and that course will really perfect your ATE assessments as well as helping you interpret ECGs. Now, some things which I also need to address, some resources you can use while you're at work, in university. So there's a few websites and books that I recommend, which I used alongside my studies. Oxford Handbook, Oxford Clinical Handbook, amazing. Oxford book for Oxford Foundation Training book, I think it's called, or the Oxford Foundation book. It's basically your foundation training Oxford Handbook, and it's amazing. If you're in your 6th year of university or you're starting your first year, it tells you everything you need to know and what will be expected of you as a foundation doctor. So get that as well. The other thing is Oski Stop. Oski Stop has a really good book. It's called I can't remember the name, but it's a very big textbook. It's called the Oski Stop book, and it has everything from practical skills to communication skills to prescribing to physical examinations to everything you will need for which will be required of you and which you'll be continually doing throughout your foundation years. So I really cannot emphasize how good the book is. Oski Stop has a website which has free resources, but I do recommend the book as well, and it's just amazing. And going on to next, I will go on to practical skills, because again, I know people are always worried about practical skills, about because as a foundation doctor, you will be expected to take bloods, to take arterial blood gases, to do catheters, to do cannulas, to do so many different things. Now, I barely practiced any of this during university, and I mean I barely practiced it. I tried my best, but it was very difficult to get access to that. If you can do that, it's great. Use your time at university to pick up and get good at those skills. But if you can't, do not worry. You can pick up those skills while you start work. It's all practice. It's all and I used to be so stressed out about my practical skills before I started work, and I'm still not great at it. I'm still just getting by, and I have my good days where I do really well, and I have bad days which I just struggle with, but everyone does, and it's completely normal. Half the time it is a hit and a miss, and it's all about practicing. So do not worry about your practical skills too much. Do try your best to learn it while you're at university, but it's not the end of the world. Being able to do a good physical examination, do a good history taking, and being able to recognize abnormal clinical presentations from what is normal is probably is definitely more useful for you before you start work. And when you go to work, as I said, try to do clinical attachments first or become an FY1 and pick up those skills during your training. Right. Another thing while you're at university, which I do recommend, is to get involved with get involved in ways to improve your CV. So I know that before I started work, I had to do I had to send off my CV, I had to do a Skype interview, and I had to talk through my CV from that. And I knew my CV would be something which, employers look at. I think everyone knows that anyway. And it's something that's very important. So while you're at university, please use your time to improve your CV. So I used to go and do clinical attachments during my breaks or clinical observerships during my summer holidays in the UK. So I would come back from university and I would do some in the local hospital. if you find that difficult to other things, do things while you're at university. So for example, get involved with society work, whether it's a medical society, whether it's another sort of society, and you know, show that you have leadership skills, show that you have organizational skills. Get involved with if you have resuscitation councils at your university. I was involved with the BG Resus Council, which one of my colleagues did. He started it himself, and you know, he made it into something which was massive, and I was very blessed that I was able to be involved in that, and that really helped me with my basic life support training and intermediate life support training, which again was the basis for my advanced life support training. So with that, other things you can do is get involved with, as I said, like society work. I started with, you know, I helped do an OSCE society at my university. If you can do some sort of teachings at university, whether it's tutoring as well, that will look great for your CV. If you can just do something extra outside of your work, outside of your university work, because you do have a lot of free time. Although we are in medical school, we have plenty of free time. We're not working. We don't have that many responsibilities as students, and we should be using our free time to do things which will improve us in a more holistic way, you know, for future medics, to become a future medic. So other things include getting involved in research. It's not hard to get involved in research, even if you're studying in Bulgaria. Go to a doctor, tell them, you know, I'm interested in research, especially if you can find someone who's doing a PhD. They will always be getting involved in research. Tell them, can I please assist you? Can I get involved and get your name in that paper? Do that. It's a great way for you to get yourself involved in research. And again, you can use that for your CV. So those are some of the things I recommend to help improve your CV while you're at university. As well as, you know, just enjoying your time at university, because once you start work, life does get busier. You have to request annual leave, and you also have to keep learning while you're working as well. But it's worth it in the end. But I do recommend that while you're at university, please enjoy the time as well. Don't stress about the future and about work. Try to enjoy this life of a student while you can, and use that time to improve on yourself, to push yourself outside of your comfort zone and push yourself outside of your normal boundaries, and just to become an all-round better student, and think about yourself for that preparation as a future doctor. So let me just check if I missed anything. So yes, those are my main tips for, you know, starting work and, you know, preparing yourself before you start work. I really hope it did help. It's not too hard for you to, you know, adjust to life in the UK. It did take me around a month or so, and I'm still learning so much. I'm not at the level of the people who started 4 months ago before me. I'm still in my training. I still feel like a baby at the hospital. But the important thing is that you tell people that you are struggling, that you communicate to people that I'm new to this. I need a little bit of help. You know, can you please support me in this? Your time in the hospital will always be a time of constant learning. You will be expected to always learn. And that will continue, whether it's on the ward, whether it's on your on-calls, whether it's during your teachings. I'm always learning, and you will be doing different things, from, as I said, from practical skills to you know, things like history taking, to doing other things. For example, not the most glamorous of jobs, which I'm sure you're aware of, but a lot of procedures which are more intimate examinations will be required of you, and you have to have a level of maturity in a lot of these things. You have to ensure that you keep your patients comfortable as well, and you have to make sure that as a doctor you need to think about your patient. You need to be responsible for them and for yourself, and there is a lot to take in. It is a big change from becoming a student to actually looking after people, to caring for people, even as a junior. So I'm not saying that it's easy in the sense that it's just an easy transition, because it is a very big jump from being a student. And in my first week, I was so scared. I don't think I've ever been more scared in my life. But it doesn't take long to adjust to it, and if you can get support, it's great. I actually started work in the hospital I'm in completely alone, as the only, you know, new doctor who had just come from a foreign country, from abroad, from Bulgaria, as an FY1. I was quite new to it all, but I had an amazing team, and I still have an amazing team who is there for me and who are aware of my situation, and I have support from NHS professionals, as well as, you know, people who are working outside the hospital, and it's just, and my fellow colleagues who are also juniors, who are very open to, you know, helping you because they were in that situation only a few months beforehand. So, you know, do take up, do be open-minded, be professional, but be open-minded to learning and admitting to mistakes and admitting to struggling as well. And I was going to say something else, but I literally can't remember what it was. Yeah, I think just bear in mind that you need to remember that this is a new stage in your life, and you will be a medic, you'll be looking after people, and you need to really take the job seriously, but don't stress out too much. Everyone is kind, people are understanding, and use everyone around you. Use the pharmacists, they're amazing. Use the nurses, they're amazing. Use the healthcare assistant, they're also amazing. Everyone on that ward will be able to help you in some way. Do not be scared, be open-minded, be open to learning, being open to making mistakes, but also ensuring that you don't get into the stage of doing a vital mistake which could end up harming someone. Take a step back, always escalate to your seniors when you're stuck. As a junior, you can always escalate to your seniors. Whenever you're unsure, just call your seniors. If you get bleeped to a situation which you are unsure about, bleep your senior, to learn your SBAR, which is your situation background assessment and recommendation, and that's the kind of communication tool you will need to be able to speak to with your senior. Tell them the situation, ask them, can you please help me, or can you recommend something? They will understand you're a junior, and you can always, you know, get their help. Yes, so I was doing that all the time. I still am doing that, but on the first week I was always going to my senior for everything, and I don't regret it at all. So those are the main things that I would like to say. I think it's just about being aware of all these different things, and one other thing is, please ensure that you are also, for this job, you need to be mentally strong as well. I forgot to say that in this job you will come across, unfortunately, you will come across death. It will be very common for you to see death unfortunately on a more regular basis than you would think. You will be required to be exposed to, you know, grieving families, patients dying, and you will have to be mentally strong for it. But you will also be exposed to a level of respect from people because you tried your best to help people, because you made a patient comfortable in some way through a medication, even as a junior, even if it's something like giving them a pain reliever or giving that patient comfort and respect. You will make a difference. So I think it's just about knowing that the journey is beautiful, but it is a big change from being a student, and just ensure that you have a good support network, whatever hospital you go into, and communicate to people that you are new, that you are learning, and don't throw yourself into something if you're not ready for it. Try to observe first and take a step back for some time. So that's my general advice. Again, I'm very sorry that it wasn't as logical as it could be, and I'm not editing it and doing all these fancy things. It was more about me sharing as much information as I could, and I will share more information in the future, and I really hope that this helped you. I can do more Q&As in the future, and I wish all of you guys the best of luck, and please don't panic about it too much. If I can do it, you guys can all do it. It's you know, it's doable, it's manageable, and it's not something which is, it's nothing to be too scared about. You will make it. You've studied abroad for that long. You've worked your socks off to get to where you are and to where you want to go, and you will get there. And I have no doubt about it that we will see many successful medics come from Bulgaria, from Romania, from all over Europe, who, you know, left the UK and gave up 6 years of their life to work in the UK, and you will make a difference. And the hospitals, they do need you. Trust me, you will be needed. The NHS needs doctors. I will tell you that myself now, from observing work, from observing, you know, staffing in the hospitals. You will be needed, so don't worry about that, but get yourself ready for it. And thank you very much for watching, and I wish you all the best. Bye.